Then let's get started. I'm State Rep Carrie Rangans from the 47th District, which covers parts of Ann Arbor, Western Washtenaw, and Southeast Jackson County. And I am joined today by my by my colleagues who are Reps McKinney, Miller, and Vanderwall, and a bunch of clinical providers who we're very excited to hear from later too. We're also really excited to celebrate National PA Week. It's this week, so we're not quite over with it. So if you need time to celebrate, you still have a few days. So today we're going to be talking about the patient-led care package. And this package includes 4 bills, which will improve patients' access to care while also reducing some of the red tape that's standing in the way of physician assistants or associates and others delivering that care. So right now, 3.5 million Michiganders live in a health provider shortage area. And, that's like more than a third of our state. And 38% of Michiganders who experience a mental illness have an unmet treatment need. So since we know patients deserve the highest quality of care from professionals who are trained to provide it, we're here trying to address this gap. Sometimes outdated laws on the books get in the way of people's ability to provide that care and address our mental health crisis right now in our state. Right now, there are about 7,400 practicing PAs in Michigan, and there's more, and about 1 in 5 of them are in primary care settings. Every year, about 550 new PAs are trained and licensed in Michigan after undergoing 6,000 hours of postgraduate clinical experience. It's a lot. Because of outdated laws, though, these 7,400 PAs, along with nurse practitioners and clinical nurse specialists, all of whom are educated and trained in behavioral health and psychiatric medicine, they're unable to help with the treatment needs of the 3.5 million Michiganders who are in that gap. This is because they're not currently recognized in our state's mental health code. So, or our state's legal definition of mental health professional. So my bill that we'll be introducing later today, so it doesn't yet have a bill number, so stay tuned, will add PAs, nurse practitioners, and clinical nurse specialists to the definition of mental health professional, which will help them be able to use their education and their training to meet the growing needs, mental health needs of Michiganders. This alone won't fix our mental health crisis. We need to do many, many things, but this is one that we absolutely have to do. My bill specifically was previously championed by then Senator Vanderwall. So I'm really appreciative to have him involved in this bipartisan package. This bill passed the Senate last year unanimously. So we expect high bipartisanship in both chambers this year. And I'm just really honored to be able to work with my colleague and Vice Chair of the Health Policy Committee, Rep Vanderwall. So let's hear a little bit more from the other bills in the package. We'll go to Rep McKinney to talk about your bill.
Thank you. Good morning. Thank you, Rep. Rygans, for your leadership on this issue. Good morning. My name is State Representative Donovan McKinney out of the 14th House District. That is Northeast Detroit, parts of Warren, and all of Centerline in Macomb County. Rep. Rygans and I recently, I think it was last week, held a joint town hall about healthcare in my district. And an issue came up consistently that was about shortage of providers and access to much needed health care, especially in the community they reside in. It is an issue that transcends the 8-mile border in the communities that I represent. I support this package because I believe it will increase access to health care for communities in great need. My specific bill in this package would eliminate clinical barriers by allowing PAs to delegate. An outdated law prevents PAs from delegating or supervising. By allowing PAs to delegate and supervise medical assistants, it would improve clinical efficiencies, hold PAs accountable, and release physicians from liability when they are not supervising. As a native Detroiter, we are home to 2 of the most respected PA medicine programs in the entire country, and I have some of the students here with us today. UAD Mercy is one of the oldest in the entire country, and Wayne State University graduates 60, soon to be 80 PAs annually. We need to keep these young people in Michigan so they can provide much needed access to healthcare options in our communities. And I'm proud to stand with them today. And I'm proud that this is a bipartisan package. And we're just excited to shepherd this through and get the governor's signature pretty soon. So thank you so much. And I'll turn it back over to Rep. Rangans.
We're going to hear next from Rep Vanderwall.
Well, thank you, everybody, and I appreciate all of you being here and especially working with my fellow representatives on an issue that has been very near and dear to my heart. We've been working on part of this package for now almost 5 years, so we really look forward to getting this done and making sure that we start filling some of the gaps that we have throughout the state. My bill, real quick, Representative Kurt Vanderwall, I serve the 102nd district, and I am one of those districts that is very, very underserved. I want to begin by saying, again, thank you to Representative Reigans for allowing me to be here and my fellow sponsors on this great legislation. One of the important facets of this bill package and the bill I have sponsored is to make Michigan a member state in the Physician Associates Licensure Compact. Membership in this compact would mean the portability of PA licenses with other member states. At the moment, PAs in other states, CAN, home of Michigan in practice, but there is a regulatory hurdle involved in obtaining Michigan license. Where this bill will really make the difference is along our borders. Medical care along the Michigan borders presents unique challenges, most especially along the Wisconsin border in the UP. We have seen instances where people get their care in one state and then fill prescriptions in another state. If these licenses aren't mutually recognized, issues can occur. This will make it clearer for the PAs in those rural areas in the Upper Peninsula and improve access to care. This compact will also attract talent to Michigan. Our state's participation in this compact will send a signal that we are open for business, and we want to encourage PAs from around the country to make Michigan their home and practice here. The same compact is already making progress in other states, including Wisconsin, Ohio, but here in Michigan, we now have the chance to pave the way for the future of our PAs and medical access. Thank you all for coming today. I appreciate it very much. We look forward to working together to make sure that we get these bills across the finish line and really make a difference here in the state of Michigan. Representative?
Thank you. Thanks, Rep. Vanderwall. Let's hear from Rep. Miller.
Good morning, everyone. I'm State Representative Reggie Miller from Michigan's 31st House District, and I'm happy to be here today supporting part of this bipartisan package of bills that would strengthen patients' access to critical health care and make them more informed over the care that they are receiving. The way we receive and deliver health care has changed, and today PAs do far more than just assist physicians. And it's time we've recognized that. I'm sorry, I'm very short. I forget to lower that. Thank you. Saying that an updated professional title needs to be done. It needs to reflect the role of the PAs in today's modern healthcare delivery for the betterment of our patients and the overall role that the PAs play in their care. Currently, the official title is physician assistant. Even though the PAs use physician assistant, my legislation seeks to change the official terminology to physician associate. It's about respect. PAs have an integral part of my personal healthcare journey. I've been treated by many, and many times I never even seen the doctor, but I knew they were working on my behalf. And I've had wonderful experiences with them. And I never thought they had the respect in the title from day one. So I was happy to take this on. By passing the Patient-Led Care Act, we make it easier for our residents to receive the physical and mental care that they deserve. Thank you. Reggie Miller, District 31.
Thank you so much, Rep. Miller. Dr. Ashley Malliott, the president of the Michigan Academy of Physician Associates.
Thank you. Well, good morning, and thank you for allowing Michigan PAs to further support and care for the communities and patients that we serve. Like was said, my name is Ashley Malliott, and I am the president of the Michigan Academy of Physician Associates. Michigan has over 7,400 PAs that are trained to practice medicine in a wide range of areas, and settings, from the ERs of Detroit all the way up to the rural healthcare settings of Iron Mountain and beyond. Our profession was founded in the face of a provider shortage during World War II. We are a profession of service. The demand for providers continues today as 3.5 million Michiganders live in a health provider shortage area. That's 3.5 million Michiganders that could be your neighbor who don't have access to basic healthcare needs, such as immunizations, cancer screenings, mental health services, and women's health needs, such as prenatal care and more. We are passionate about the communities and lives that we impact. PAs truly do go beyond, and yes, PAs can do that despite sometimes what others may think. Patients are starting to understand how they can trust their PA, the PA that they love and that they want to see. Michigan patients inspire us, and our communities continue to challenge us to do more, to provide patient-centered, safe, evidence-based care from board-certified providers like PAs. We are asking for these changes, not on our behalf, but on the behalf of our patients that we serve. It's their pain that we see when laws prevent them from being able to live healthier lifestyles. And they are the ones that suffer when we cannot function as our education, training, and board certification allow us to. Patient-led care improves access to the highest quality of care that there is. Unfortunately, our public health code and mental health code has failed to provide for this and allow for optimal patient-led care. The patient-led care bill package that you've heard about today seeks to expand this access to mental health care, ensure medical assistants are well-trained, and eliminate those clinical practice barriers that we face as PAs. It allows for our patients' care to cross the state lines, particularly in those rural health communities along the Wisconsin border. And it clearly communicates that you can trust your physician associate. PAs stand ready to serve our patients in every part of Michigan, but we have the capability to do so much more. We will advocate for our patients legislatively, just like we do clinically every day. Because at the end of the day, that's why we are all here, to improve each and every one of our patients' lives. Thank you.
Thank you, Dr. Mallier. All right, we're going to have two folks come up. Ken Gorney, a psychiatric PA from Sparrow and McLaren in Lansing, and Dr. Sonia Dhaliwal, a psychiatrist. Psychiatrist with Sparrow. Come on up. You can come up together if you want.
I'll take point. Dr. Dhaliwal and I work together collegially at Sparrow Hospital in psychiatry. And I want to say what a privilege and honor it is today to stand next to her as two collaborating professions to serve our community. It's a very exciting time. I cannot express my gratitude enough to the representatives that are taking the lead on this. I have all kinds of colleagues from our health system. Kara Robertson, our COO, is here. Tammy Banker, Director of Behavioral Health. Our patient advocates and court liaisons are here today to support us in this bill, clinical nurse specialists. Just very exciting. All the students behind us that we're training right now in psychiatry and other professions. And it's just an exciting time. I'm reminded as we go into PA Week just how much we've evolved since 1967 when our profession just developed, and how access to care has really expanded, and this will certainly perpetuate that. So thank you again, Dr. Dhaliwal.
Thanks for having me here today. So I trained at Central Michigan University in Saginaw, and now I'm a psychiatrist at Sparrow Hospital at the St. Lawrence campus. And throughout my whole journey as a clinician, I've always felt supported by PAs and NPs. And especially since coming to Sparrow, it's just been a pleasure working with the PAs who I've always viewed as my colleagues. And how much Ken has helped me since I've moved up to the geriatric unit. We've always functioned as a team. And I think when we work as a team, that's how we provide the best care to our patients. And I also want to say that, providers, the things we experience on a daily basis can sometimes be overwhelming, and it contributes to burnout. And when providers are taken care of, patients get the best care. And so respect for our providers is so important. I think that's what this bill is trying to put forth. So I think I speak for many physicians when I say this is a great move for providers and for the patients in Michigan. Thank you.
Thank you both so much. Dr. Marianne McCoy, the past president of the Michigan Council of Nurse Practitioners, Kalana, thank you so much for being here. Important partner organization.
Welcome all of my PA colleagues. I'm here to represent Michigan Council of Nurse Practitioners. One of the bills that's in this packet is also, we call the mental health portion of it. One of the biggest barriers to patient access to care is recognition of the professionals behind us, the clinical nurse specialists and the nurse practitioners who actually work in behavioral health, mental health. We know we have an epidemic portion of illnesses, mental health being one of the probably the broadest health issue we have here in Michigan, along with substance abuse. We need to be able to understand that as a professional, all these people who are going to school or who are behind me, clinical nurse specialists, myself, need to be recognized in the mental health code as a profession in there. Currently, we are not. Our titling is not there. So that's one portion of that bill. The other portion is actually one of the things that really is important in regards to access to care, but actually to initiation of care. There is a two-step process when someone who is need an involuntary commitment, which is a terrible thing to happen, but sometimes people do have a period of time where they're unsafe to themselves or to the public. Currently, it is in the mental health code that none of us as providers who see patients are allowed to start that process. It's a two-step process. The first step with what we're asking for is that to let us see who we're on the battlefield of healthcare, to actually see the patient, assess them appropriately for the first step. The second step is psychiatry evaluation to confirm that they're incapable of taking care of themselves. It would unload our emergency rooms and a lot of the crisis centers to get help for these people. And so those are the basics of the mental health care portion of it. I think it goes along with some of these other bills that you're seeing, that there is barriers in statute language that prevents many of us, nurse practitioner, clinical nurse specialists, and PAs, from really helping and being a key partner with everyone in healthcare to help the citizens of Michigan. Thank you for your time.
Thank you so much. Right, that wraps up our speakers. I want to just add one thing about adding additional providers to the mental health code. I think folks in here might remember that in our last budget, we just approved funding for 19 additional certified clinical behavioral health centers in Michigan, CCBHCs. And in order to make sure that we are staffing adequately across the whole state, recognizing all the providers that have been trained in behavioral health care is really important to making sure that we are addressing gaps in mental health services across our state. So with that, let's take some questions. And you can direct it yourself at any individual or ask the question and somebody will step forward to answer it.
I just want to be curious about Representative Vanderwall's bill on the blood machine intervention compact. Governor Whitmer has vetoed similar bills in the past. Why do you feel like this is going to be so?
Well, I believe that through this legislation and through some of the lessons learned on some of our past, that we know now how critical being able to provide care. And one of the goals, as our governor stated, is we want to grow Michigan's population. We can only grow Michigan's population by having a solid health care system, and this will really help that.
And similarly, some about some of the opposition received last time around Michigan Clinical Society, Michigan Psychiatric Society, Michigan, etc. This is a bipartisan thing that got a lot of support in the Senate, but what's your plan for kind of getting some of those additional groups on board or getting past the opposition?
So I don't know if the goal is necessarily always to get every group on board for everything that we do, right? And I'm a new legislator, and one of the things that I learned so far this semester, I worked in an academic setting previously. So one of the things I learned this term actually so far is that in the healthcare space, anything you do that could potentially help patients sometimes ruffles feathers of some professional group. And sometimes you just have to focus on what's best for patients. And with the patient-led care package that we're talking about today, what is best for patients will ultimately convince folks that, you know what, if this is best for patients, to make sure that we have enough providers who are trained with extensive training in behavioral health services, this can only help other providers. So I think even if they become neutral, stay opposed, whatever, in the end, this is what's best for patients. And that's really what drives me as a legislator. And I think many of my colleagues too. So we have a huge list of things that we're working on right now. And so we will be introducing the bills today. They're already bipartisan by sponsor, but also co-sponsors. So we're still collecting co-sponsorships in the House, and then we'll introduce them today. They should be able to go to the Health Policy, I'm hoping Health Policy Committee, because they all amend the Public Health Code. Anytime thereafter. I know in conversations with Chair Rogers and Vice Chair Vanderwall that there's a full docket with the Health Policy Committee, but we're still gonna, do our best to charm our way onto that agenda this calendar year. But we still have plenty of time this term. So, and this is very bipartisan. So this is like a great election year thing, if nothing else.
With PAs, I've had them involved. There you go. I've had them involved in many aspects of my healthcare, and I've talked to many of my cohorts, my neighbors, my friends, and it's also very confusing on that title as to what that really means. And this will clarify this. This will get it out there as to what they are and what they can provide and what they can do for us. I think they're underrated, and we're not promoting them enough. I think we need to change that culture. Thank you.
And I would add to that as well. I'm a clinician of 13 years, and I've had the privilege of practicing actually in inner city Detroit, advanced heart failure and cardiac transplant. And what I can tell you is our legal title has an apostrophe S attached to it, physician's assistant. And I want to be clear, we are not owned by another profession. We serve our patients. If anyone owns us, it's our patients. And there is probably multiple of us PAs and even students that have seen us at other providers where we can walk into a room and we get told, well, I don't want to see the assistant. I want to see the physician. And that word assistant really does provide a barrier sometimes to have our patients trust in what our abilities are. Like you've heard, we have over 6,000 hours. Talk to any of the PA students in the room. They will tell you it is probably one of the toughest things they've gone through PA school. So changing that nomenclature, yes, it is a word. And I know there are some that'll say it's just a word, but we know words matter. Right. And so it's just about making sure our patients get the full scope of what we can do.